The risk of COVID vaccines, a needle in a haystack. Have you been wondering about the risk of COVID vaccines? I have. Not too long ago, we heard that the AstraZeneca vaccine, which is not yet available in the US, might cause a rare blood clotting disorder. And now we're hearing the same thing about the Johnson & Johnson vaccine. Should we be concerned? In short, yes and no. Yes, because there is good evidence that these clots are caused by the vaccines. No, because the benefits still outweigh the risks by a country mile. Let's take a closer look. First, we should note that the two vaccines mainly in use in the US are not these two products. In the US, we have used primarily the two-dose Pfizer-BioNTech and Moderna products, which are an entirely different type of vaccine than the other two, and have not been shown to cause blood clotting problems. With more than 200 million doses given in the US, we are reassured that these two vaccines are astonishingly safe. In fact, not a single fatal reaction has been linked to either one. The CDC reports that they can rarely cause a severe allergic reaction known as anaphylaxis, but none of those have been fatal. Other than that, there have been no serious side effects. So let's give them a report card. How many clotting complications for every million doses? 0. How many severe allergic reactions? 3 to 5 per million. That's 3 for Moderna and 5 for Pfizer. How many fatal complications? 0. Honestly, I cannot think of a single medication I have ever prescribed that is as safe as this. Not even aspirin, as you will learn shortly. So there is no reason to hesitate to take either of these two. Now back to the AstraZeneca and Johnson & Johnson vaccines. The single-dose J&J vaccine was approved for use in the US at the end of February. Over the next 6 weeks, it was given to nearly 8 million Americans. Among this group, there were 15 reported cases of that same specific type of blood clotting disorder, mostly in women under the age of 50. 3 were fatal. That is less than 1 per million. In response, the vaccine was put on a temporary pause that is now lifted. In Europe, the AstraZeneca vaccine was associated with 18 fatal cases among 25 million vaccinated people, which is also a bit less than 1 per million, similar to the J&J experience. So what we have here is a lethal but very rare complication, literally a 1 in a million long shot, which by the way is less likely than being struck by lightning in a given year. Let's put this number in further context. First, unlike lightning strikes, blood clots are very common. When one occurs in a blood vessel, we call it a thrombosis. When it travels to the lungs, we call it a pulmonary embolism. Each week, about 1,500 Americans die from blood clots. I know what you're thinking. If there are 1,500 deaths from blood clots happening each week, how do we know that one particular death was due to the vaccine? Isn't that like finding a needle in a haystack? Not necessarily, because these clots we have been talking about have the clinical signature of a rare condition known as heparin-induced thrombocytopenia, or HIT. That signature includes the sudden and dramatic drop in the number of platelets, or thrombocytes, circulating in the bloodstream. In our naming convention, penia means deficiency, so thrombocytopenia equals a low platelet count, and that is very unusual. Whenever someone develops a blood clotting disorder and a low platelet count while taking heparin, we think of HIT. That's what I mean by a clinical signature. Now, heparin is an anticoagulant that we use frequently in hospitals to prevent blood clots. But as I have just described, it can rarely, paradoxically, cause blood clots when it triggers the HIT reaction. Of course, that is the opposite of what we want, so that is Mother Nature being truly ironic. The vaccine-related clotting cases look just like HIT, except none of these patients received heparin. When we have thrombosis plus thrombocytopenia without heparin, we call it thrombosis with thrombocytopenia syndrome, of course, or TTS. And you can think of TTS and HIT as being roughly equivalent. These cases are very peculiar, and the best explanation is that they are caused by the vaccine itself. They really are the needles that stand out in the haystack. So let's put these two vaccines on our report card. The estimates here are based on AstraZeneca's European experience, which is still evolving. The number of TTS cases per billion people so far is 10. The number of anaphylaxis cases is currently not established, but some have been reported. And the number of deaths per million is slightly less than 1, all from TTS, the clotting disorder we have been discussing. So, if a vaccine can cause a rare case of fatal thrombosis, does that mean we should avoid it? Absolutely not. Almost every medicine we doctors prescribe can do great harm to a tiny number of people. For example, we use the penicillin family of antibiotics for almost any type of infection. Did you know that for every million times we use penicillin, we cause about 20 deaths from anaphylaxis? That's right, 20 deaths. Aspirin is even worse. For every 1 million patients treated, even the lowest dose of aspirin causes about 100 fatal hemorrhagic strokes per year. 100. That doesn't stop us from prescribing penicillin or aspirin because on balance they provide so much more good than harm. And heparin? Let's not even go there. Even the lowest dose of heparin, which we give to prevent blood clots, can cause HIT. For every million treatments, low-dose heparin causes about 400 cases of HIT, way more than the AstraZeneca vaccine, which causes only 10 cases of TTS per million. Yet we use heparin routinely in most hospitalized patients because it does way more good than harm. Totally worth it. The same is true for the J&J vaccine. Based on our experience so far, the CDC has estimated that the next 10 million doses of this vaccine will prevent 1,400 deaths while causing 26 cases of TTS. That is more than 50 lives saved for every patient harmed. And since less than 1 in 10 TTS cases are fatal, that is 500 lives saved for every fatality caused. 500 to 1. But here's the thing. Even though I know the vaccines we're rolling out are going to prevent many thousands of future deaths, I don't actually know which future people we are saving, because I don't know who would have died without the vaccine. Those future lives saved are unidentified. They're anonymous. But I do know the identity of that one person who died of a clotting complication. She has a name and a face. Try explaining all this math to her family. So how do I weigh the value of one life lost that I know of versus 500 lives potentially saved that I can't even name? That's why it can be very difficult to weigh pros and cons about a treatment, even one as obviously beneficial as this one. So what to do? First of all, if this really freaks you out, and especially if you're a woman under the age of 50, you should stick with the Pfizer and Moderna products, which are equally and phenomenally effective, extraordinarily safe, and plentiful. If you don't like the idea of 2 shots, you can still go with the J&J vaccine, knowing the benefit far outweighs the risk by about 500 to 1. Hi, I'm Nate Link, and I hope you were enlightened by this video essay. For more video essays on evidence-based politics and science, please join my YouTube channel, Nate Link MD, and read my book, The Ailing Nation, winner of 2 National Book Awards and available online at Amazon and Barnes & Noble. Thank you.